CCMA NHA Study Guide. Question 1. A patient's adult child calls requesting medical information stating they help manage the patient's care. What must the CCMA verify before releasing any information? Relationship to the patient, patient's insurance status, reason for the request, written authorization on file. HIPAA requires documented written authorization before PHI can be released to anyone other than the patient, regardless of family relationship or caregiving role. Verbal claims of relationship are insufficient without proper authorization on file. Question 2. Which situation represents a clear HIPAA violation? Logging out of the EHR, speaking quietly at the front desk, discussing patient information in an elevator, shredding old records. Elevators are public spaces where unauthorized individuals may overhear conversations. Discussing PHI in any public area where others can overhear constitutes a direct HIPAA violation, regardless of volume. Question 3. A CMA routinely does not collect copays to keep patients happy. This behavior is best described as insurance fraud risk, professional courtesy, patient advocacy, office efficiency. Insurance contracts require copay collection as part of the patient's financial responsibility. Routinely waiving copays without policy approval may be considered fraudulent billing behavior and could result in audits, fines, and legal penalties. Question 4. Which task is clearly outside the CCMA scope of practice? Entering codes assigned by the provider, explaining billing statements, interpreting abnormal lab results, scheduling follow-up visits. Interpreting lab results requires clinical judgment and medical training. This task must be performed by licensed healthcare providers such as physicians, nurses, or physician assistants, not administrative staff. Question 5. A patient becomes angry and raises their voice at the front desk. What is the most appropriate CCMA response? Remain calm and listen actively. Match the patient's tone. Ask the patient to leave. Ignore the behavior. Remaining calm, listening actively, and acknowledging the patient's concerns helps de-escalate tense situations while maintaining professionalism. Matching anger or ignoring the patient would escalate conflict and damage the provider-patient relationship. Question 6. Which document legally authorizes the release of patient information? Release of information form, advance directive, encounter form, insurance card. A signed release of information, ROI, form is legally required before sharing PHI with third parties. It must specify what information can be disclosed, to whom, and for what purpose, along with an expiration date. Question 7. A fax containing PHI is sent to the wrong number. What should the CCMA do first? Notify the patient immediately. Destroy the original record. Follow the office breach protocol. Ignore unless reported. HIPAA requires immediate action following office breach procedures when PHI is misdirected. The protocol typically includes notifying the supervisor, documenting the incident, and attempting to retrieve the misdirected fax to minimize harm and ensure compliance. Question 8. Why is verifying insurance eligibility before the appointment critical? To reduce appointment time, to prevent claim denials and billing issues, to eliminate patient copays, to replace pre-authorization. Eligibility verification confirms active coverage, benefits, and patient financial responsibility before services are rendered. This prevents denied claims, reduces billing disputes, and avoids unexpected patient bills, improving both revenue cycle management and patient satisfaction. Question 9. What is the primary purpose of a patient encounter form? Track attendance. document services for billing, record diagnosis, schedule follow-ups. Encounter forms, also called superbills, document the services performed during a patient visit, including procedures, diagnoses, and charges. They support accurate billing by providing the information needed to complete CMS 1500 or UB 04 claim forms. Question 10. Which behavior best reflects ethical conduct? Prioritizing friends' appointments, sharing patient stories without names, treating all patients equally, accepting gifts for favors. Ethical practice requires fairness, respect, and equal treatment of all patients regardless of personal relationships or circumstances. Favoritism, sharing patient information, even anonymized, and accepting gifts for preferential treatment violate professional ethics and may breach compliance standards. Question 11. What is the biggest risk of inaccurate patient data entry? Slower check-in process, wrong patient care or billing errors, poor office appearance, extra paperwork. Incorrect data entry can lead to serious consequences including medical errors, wrong patient, wrong procedure, claim denials, incorrect billing, and legal liability. Accuracy in patient identification and data entry is a critical patient safety measure. Question 12. A patient asks for medical advice at the front desk. What should the CCMA do? Offer general advice, provide online resources, refer the patient to a licensed provider, share personal experience. CMAs must stay within their scope of practice and never give medical advice, which requires clinical licensure. The appropriate response is to politely explain that only licensed providers can give medical advice and offer to schedule an appointment or relay the question to clinical staff. Question 13. Why must computer screens be locked when unattended? Improve office organization, prevent unauthorized PHI access, reduce system errors, save electricity. Unlocked screens displaying patient information expose PHI to unauthorized individuals who may pass by the workstation. Locking screens when unattended is a required physical safeguard under HIPAA to prevent potential data breaches and unauthorized access to medical records. Question 14. What does minimum necessary mean under HIPAA? Share all information with all staff. Share only what is needed for the task. Share information verbally only. Share with staff freely. The minimum necessary principle requires covered entities to limit access to PHI to only the information reasonably needed to perform a specific job function. Staff should not have access to entire records unless required for their duties. This reduces the risk of unnecessary exposure. Question 15. A patient refuses to pay a required copay. What is the best CMA response? Waive the copay, cancel the appointment, explain insurance requirements and office policy, argue with the patient. The CMA should clearly and respectfully explain that copays are required by the patient's insurance contract and office policy. Offering alternatives such as payment plans or speaking with a billing supervisor maintains professionalism while ensuring compliance with insurance agreements. Question 16. Which action could result in legal consequences for the office? Verifying patient identity, inaccurate billing codes, scheduling delays, appointment reminders. Inaccurate billing codes constitute fraud and can result in audits, fines, overpayment recoupment, exclusion from federal programs, and legal penalties under the False Claims Act. Accurate coding is essential for both compliance and reimbursement. Question 17. Why is accurate documentation legally important? Improves workflow, protects against liability and supports billing, reduces staff workload, improves marketing. Accurate medical documentation serves as legal evidence of care provided, supports billing and coding, and protects providers against malpractice claims. Poor documentation can lead to denied claims, audits, and legal liability in adverse outcomes. Question 18. What should a CCMA do when unsure about releasing information? Release cautiously. Yes. Consult supervisor or policy. Refuse permanently. When uncertain about whether information can be released, the CCMA should consult office policy, a supervisor, or the compliance officer. Guessing or making assumptions could result in HIPAA violations or improper disclosure of PHI. Question 19. Which scenario requires immediate supervisor notification? Suspected PHI breach, lost patient file, appointment reschedule, late arrival. Suspected PHI breaches carry legal consequences, including potential fines and mandatory reporting requirements. Such incidents must be reported immediately to a supervisor or compliance officer to initiate breach protocol and minimize harm. Question 20. What is the main goal of the CCMA role? Increase revenue, replace providers, support safe and efficient patient care, reduce staff. The CCMA's primary role is to support safe, efficient, and patient-centered care through administrative tasks such as scheduling, registration, billing, and records management. Administrative efficiency directly impacts patient safety and quality of care. Question 21. Why is patient identification verified using two identifiers? Office policy only. Prevent wrong patient errors. Speed up visits. Reduce paperwork. Using two patient identifiers, e.g., name and date of birth, before any procedure or disclosure reduces the risk of wrong patient errors. This is a national patient safety goal and critical for preventing serious medical and billing mistakes. Question 22. What is the purpose of pre-authorization? Confirm diagnosis, replace insurance, reduce copays, obtain approval before services. Pre-authorization or prior authorization requires the provider to obtain insurer approval before performing certain procedures or services. This confirms medical necessity and coverage, preventing claim denials and unexpected patient financial responsibility. Question 23. Which communication practice improves patient satisfaction? Rushed explanations, medical jargon, minimal interaction, active listening. Active listening involves giving full attention, acknowledging patient concerns, and responding thoughtfully. This builds trust, improves understanding, and enhances patient satisfaction, while rushing, using jargon, or minimizing interaction damages the provider-patient relationship. Question 24. Why must CCMAs avoid altering medical records? It slows workflow. It is unethical and illegal. Patients dislike it. Insurance forbids it. Altering medical records compromises their integrity and is both unethical and illegal. Changes must be made with a single line through the error, notation of correction, initials, and date. Never use correction fluid or delete entries, as this may be viewed as falsification. Question 25. What defines professionalism in healthcare? Dress code only, speed only, behavior, ethics, and communication. Authority. Professionalism in healthcare encompasses respectful behavior, ethical decision-making, effective communication, accountability, and commitment to patient-centered care. It includes appearance, but extends far beyond dress code to core values and conduct.